and this is The News with Sara Hutt.
Hello. Parents, your child is coughing, has a fever, and night sweats. You think it's just seasonal flu. But what if the symptoms indicate something more serious? Here to talk today about infectious diseases are public health nurses Rina and Ciara.
Thank you, Sara. So tuberculosis is caused by a bacteria that's called Mycobacterium tuberculosis. It often manifests in the lungs, but it can also spread to other organs of the body. People often delay seeking care for this disease because the symptoms are so mild and are mistaken for something else, like Sara had mentioned, the flu. According to the World Health Organization, there are about 9 million cases every year, but of those 9 million, 3 million cases are missed because people aren't aware that they have the disease.
More specifically to your children, they're at higher risk for developing TB due to their lower immune systems. A study in 2015 of exposed children, 40% of those children develop latent infections, while only 10% of the adults develop latent infections. The current screening process is inadequate for children because initially we have the PPD test. It's the test that you get on your arm when you get a new job or when you go for your annual. And it's developed on a hypersensitivity that doesn't show in children from 8 to 12 weeks post-exposure. So they develop the exposure that doesn't, no, that is so rambly. I just ramble.
Go ahead.
So after you get your PPD results, you may think a negative result means that your child definitely does not have TB. Unfortunately, in children, their progression is more severe and they can go from a latent infection to an active form more quickly. And in children, they tend to have more severe infections, including miliary TB, which affects the entire respiratory system, and even meningeal TB.
Yep.
So when you get your PPD response and it comes back negative for your child, you may be thinking that they're clear of TB, when actually they could have had a latent form of TB that progresses more quickly into the active forms. And unfortunately in children, active forms tend to be more severe. So you could develop a miliary form of TB, which affects the entire respiratory system, and a meningeal form of TB that affects the brain.
So next, we would like to talk to you about the medication regimen. It's very lengthy. It lasts from 6 to 9 months in order to get rid of this disease. And that causes a lot of complications because people don't adhere to this plan. So often what happens is people will start the medication and not finish it, and a resistance to the medication will occur, and they call it multi-drug resistant tuberculosis, and that's even harder to treat. So it's so important to educate and to know the regimen to follow in order to treat this disease, to prevent resistance from happening. According to the World Health Organization, in 2015, there were over 480,000 new cases. So by educating you as parents to really push your kids to take their medications to the full length will reduce this number.
Thanks, Sara. And for more information, you can always visit the CDC website or the World Health Organization for more information.
Thanks, guys. A lot of good information. And if you see any of these signs or symptoms in your children, please contact your family health care provider. This has been The News with Sara Hutt.